Hello, everybody. Welcome. Let's just take a couple minutes and let everybody else join in. Okay, so maybe we'll get started. Good afternoon. This is Dr. Aida Wen. I'm a geriatrician with the Department of Geriatric Medicine at JAPSOM and the course director of this Project ECHO Long-Term Care Learning Action Network. And it's always good to see everyone. For attendance purposes, put your name in the chat box as our way of taking attendance. And if you have a smartphone, you can still try to do this as well. Next slide. The Pacific Islands GWEP program at JAPSOM is partnering with the Healthcare Association of Hawaii, Mountain Pacific Quality Health, and we are happy to announce that we actually have two new partners who stepped up to help sponsor these ECHO sessions for you. That's United Healthcare and Aloha Care. We are using this Project ECHO model to provide education and opportunity for discussion of challenging cases. So we really encourage everyone to share experiences and practical ideas so that we can all learn and grow from each other. Next slide. We are committed to safeguarding confidentiality of information, and so everything we share must be HIPAA compliant and safe in creating a safe learning environment. So that means we're not going to be embarrassed or create negativity. Rather, that we're going to just be openly sharing and encouraging each other. No blame, no shame. Okay, and just a note that these case consultations do not create or otherwise establish provider-patient relationships between any ECHO specialists and patients whose cases are mentioned during this ECHO setting. Next slide. Okay, so this is, we've been going through the STEAM, taking copy to success, and we're here in February, number 2, and we're going to be creating flowcharts and streamlining your process of telemedicine. Next slide. So some of the goals of this ECHO series is that to have nursing homes that deliver superb care and establish a community of learning. We also want to help our facilities apply QI principles more consistently and prevent COVID as well. And we're also going to provide some input from IHI. We're also going to try to help promote the IHI age-friendly health system goals of the 4 M's. Next slide. And if you would like to share your experiences and challenges with us, you can fill in a case presentation template found on the ECHO website where you registered. And if you give us a heads up, we can try to prepare and address your specific challenges in upcoming sessions. Next slide. Regarding CME, this is sponsored by the Hawaii Consortium of Continuing Medical Education, and it's also approved by the National Association of Social Workers, and it is approved for one social work continuing education contact hour as well. As a reminder, you must complete the evaluation form in order to receive any CEs, CMEs, or certificates of attendance. The evaluations can be found on our website under the Evaluations tab. And if you haven't done so already, you can always go back and register. Okay, so next slide. Oh, that's it. Okay, so just introductions again. If you've joined a little bit later, just want to remind you, please type your name into the chat box, and all those in the room watching the same screen as you, and that is our way of taking attendance. Our speaker today is Joy Yadao. She is a registered nurse with more than 25 years of experience in nursing care and leadership in the specialties of pediatrics, trauma, oncology, wound care, case management, utilization management, end-of-life care advocacy, infection prevention, and quality metrics. Many of you know her as she has held positions at Queens Medical Center, HMSA, St. Francis, Healthcare Association of Hawaii, Mountain Pacific, and now Kuakini Medical Center. She's currently the infection prevention specialist developing protocols during this pandemic and is most passionate about using her expertise and skills to improve healthcare in her community. And as you know, all sponsors of CME are required to execute a conflict of interest policy, and speakers are expected to disclose to their audience any real or apparent conflicts of interest that may be part of the subject matter. And today, Joy Yadao discloses that she owns her own healthcare consulting company called About You Healthcare Consulting. She is not promoting her services or being paid for services for this talk. She's only providing for education only. So without further ado, I'm going to give Joy Yadao the floor. Thank you, Joy.
Thank you so much, Aida. I appreciate that. Let's see, can you see my screen? I don't know if you can see it yet.
Yes, we can.
Okay, good. Then I'll start the slideshow. This I found to be a really interesting topic because flowcharts are sometimes a little intimidating to create. Like, oh, how do I do that? I don't know how to do it. And I actually, when preparing for this today, I learned quite a few things. And so I'm happy to share some of the new and easy ways that we can create flowcharts and how that would apply to, setting up your telemedicine workflow in your facility. Because with every workflow, we really have to have it clear and direct. So for today, I want to help you learn to create a flowchart for telemedicine and identify what kind of obstacles we might have to using our creative, juices to create new workflows. And then also review the software options for some of that creation, because we all use different platforms and different formats nowadays. There's a lot of options available. And then we'll have some peer case sharing. So this should be a really, really good talk, and I'm just going to kind of blow through my portion of it. And first of all is why flowcharts? I mean, some of us really like to write policy. I know that's kind of weird, but I like to write policy, and I like to write it all down in sentences with good grammar and all that kind of stuff. But when working as a nurse, I don't have time to read through somebody else's well-thought policy. And I really just would appreciate a visual process so that I can easily see where we're headed. I can skip, over a few steps and see the end. What's the goal here? And let's get going and follow a map. So a flowchart will show the different steps of the process. It really helps to avoid omissions, because sometimes as a healthcare worker, we might skip something. Because we're just doing it off the top of our head, and we're not perfect, and we might skip a step that could be very important or could affect someone else's work. It provides consistency, and whenever I say that, I remember this session that I took was one of those kind of motivational speaker sessions, and the leader said to everybody in the room, we were all at tables at a big room, and said, okay, everybody take out a piece of paper and draw a pig. And so we all drew a pig on a paper, and then he said, okay, hold up your papers, let everybody see. And when we looked around the room, you can see all different kinds of pigs, the face of the pig, the body, some people had the little curly tail, some people had, all different colors. And then he said, okay, take out another piece of paper, and let me tell you, first we're gonna draw a circle. And we drew the circle on the page, and he had a big whiteboard up in the front, and he was leading, okay, now you put these two little triangle ears on the circle, and then you put the face, and then you put this and that. And when everybody held up their second picture, they were not identical, but they were very similar. And that's how you provide consistency, if you give step-by-step directions. If you just say what you want at the end, draw a pig, well, that could mean different things to different people. So we want to provide consistency with a flow chart that gives an exact map on how to do things. it also defines the responsibility that each person has. The nurse does this, the doctor does that, somebody else files this form or puts things in the computer. That way, everyone knows what they're supposed to be doing, and there's no misunderstanding. And it also allows the leader to go back, or whoever is in charge of that process, to go back and look at it and see how we've been doing. Are we following the exact steps, or do they need to be changed? Maybe the flow chart needs to be changed and put into a more realistic, viewpoint, or maybe we need to teach the staff how to do it a little differently. So actually, when thinking about how I'm saying this, it's actually the PDSA process, where we start with our flow chart, and then we actually do it, and then we take a look at it and study it and go back and maybe make some changes. So, it's very consistent with how we do other things. The decisions that you have to make if you're going to make a flow chart are kind of fun. There are so many different platforms that you can use depending on what you already have on your computer or in your facility. If you have Visio was always intimidating to me. I always found it difficult to use, but I know it's improved over the years, and it is a Microsoft product, but it is something you buy separately from Windows. There's a company called Creately that I found that was interesting, and I'll show some things from them later. If you have Word, you can do it in Word or Excel, whichever you feel most comfortable in, or even PowerPoint. And actually, the process is all the same for the Windows applications. And then if you use Google, if you're a facility that uses Google Drive and Google Docs, then there is something called Google Drawings, and I'll take you to that later on. If you are stuck and don't know how to get started, believe me, you can look on YouTube for just about anything in the world. If you want to learn how to change a tire, if you want to learn how to cook a souffle, whatever you want to do, you just say how to and anything else. How to make a flow chart. You can even say, and I tried this, how to create a flow chart for telemedicine in a nursing facility. So, you can get as specific as you want. So use the things that are free and available to you. And most importantly, you just want to start with a simple map. Okay, you've got to have a starting place where you're going to start in the process, and you've got to have a finish where you want to end up. And really, this is the meat that you're going to put on the bones. All the decisions along the way, who does what, where do you go, what do you do? That's the part that becomes the investigation and the flow, and you need more help to do it. You have to involve your team. Okay, you cannot just do this sitting in your office thinking that you know everything about the workflow of everyone, because there are too many people involved, because we are a team, and you may not know that, oh, you have to dial 9 before you call something out on your facility, or to connect to Zoom you have to do this, or this paperwork has to go here and a copy has to go to the DON, or whatever it might be. So ask your team, get them involved. You don't want to rewrite this 5 times, although you might have to. Gather your information before. So what kind of information do you need to gather before the telemedicine visit? That may be a different workflow. It may even be a separate workflow for certain staff to get some information, or for the physician to gather information before this visit occurs, because you want the telemedicine visit to be as effective and efficient as possible. And when do you make a telemedicine visit? Is it at the physician discretion? Is it at the nurse discretion? Is this for emergencies? When are you going to do that? And when is it preferred over a simple phone call? It's important for staff to know what the parameters are on when they use what method. And when you're going to do telemedicine, obviously you're visualizing the patient. It's nice to talk to the team over telemedicine, but the real purpose is to see the patient. So what do you need to do to visualize that patient? You may have to get the patient ready, make sure that they're in the right place, make sure they have their clothes on would be nice, or maybe not, and make sure that they're in the right position to help with that phone call. And then how do you document it? What do you have to do? Is there paperwork you have to do? Is something going to go in the chart? Is something go in a separate area for billing? How does this get documented that this visit occurred, and what elements of it do you want in the medical record? So you have to consider the workflows before the call, during, and definitely after the visit to make sure that you've captured all the little pieces. Otherwise, something will fall through the cracks. So it's best to think about it ahead of time. So now let's just look at the basics of a flow chart. Everybody pretty much makes a flow chart the same way, using the same symbols. You can have some variation depending on, what you're doing internally, but it's good to know that these symbols, these shapes, actually convey meaning, and that, we've all kind of accepted these shapes as part of the flow chart. So first of all is a box with rounded corners. It might even be small or even half the size of this box. A rounded rectangle is for either starting or terminating the state. So at the beginning, you're going to have one of these, and at the end, you're going to have one. And it can be in a different color. Of course, PowerPoint just made them in this color since I had the theme already. But you can make them in different colors, and I suggest that the starting and stopping be in another color, like red. That's usually, or some kind of light red, or you can choose purple, whatever you want, but just make it consistent. The next shape is a box with straight corners, your regular rectangle, and that represents the process. These are the stages of the process. So you're going to start here, and then you're going to have stage 1, stage 2, then you do this, then you do that, and it keeps going with these types of boxes. Whenever you see a parallelogram or this slanted type of rectangle, that usually means that data is required. You need to input some data, or that data is going to be, needed for this stage of the flow chart. Where did my cursor go? There we go. When you see a diamond, and diamonds are often in green, I've found, for most flow charts, but you can make them whatever color you want. The diamond usually means that there's a decision to make. This is a branching off of your flow chart so that you can go either to the right or to the left. So oftentimes this is a yes or no decision. If you say no, it goes this way. And if you say yes, it's going to go another way. Sometimes it's a branching, like you're going to either do process A or process B, or you're going to call Dr. A or Dr. B, or whatever kind of decision making that you need to do, that's when you use a diamond. Now the arrows will show the flow of the process. You can have a direct arrow with one side pointed, or you can have a double-sided arrow, meaning it can go either way. You can have arrows that are graduated, arrows that loop around and go back up to the start. If you do this and that and this and that, then you got to go back to part A. So the arrows are very important, but my suggestion when you're creating a flow chart is to use your boxes, make your flow chart, and when you're all done, or when you think you're done, then you put the arrows in place to show how it's going to flow. Because you may find that you're going to move things around, like, oh, let's do this one first instead of that one, and then you've got to fool around with all the arrows. So I like to think, in the old days when we did flow charts, we did them with Post-it notes on a piece of big paper, and you can move the Post-it notes all around until you got the right flow. And then you can actually fill in the data. So if you use Microsoft Word, this is where you can find it. So you just go to Word and to Shapes, right on the regular homepage, you're going to find Shapes. And this is not live, so I can't drop it down, but I'll show you later. When you drop down this menu, a whole bunch of shapes come up, and you can pick and choose. There is a category of shapes called Flowchart, and I recommend that you use that. But there are other shapes. You can put in a smiley face. You can put in whatever you want to make it fun in your facility. But for the professional look, you probably want to stick with the Flowchart shapes, because they are made in conjunction with, what I showed you earlier, the basics of how we do it. So I just kind of started one just easy. And of course, I start it with the nurse decides to make a telemedicine call, and that's my start. And I said, uh-oh, the nurse better get her stuff together before she makes this call. Go ahead. And so equally on the same level, she's got to get vitals. She's got to make sure she has a updated skin assessment, that she's listened to those lungs, whatever it might pertain, because you know what the doctor is going to ask. And then her decision was, uh-oh, do I call Dr. A or Dr. B? Who's on a rotation, or who am I supposed to call? Is it the attending? Is there a geriatrician, etc., depending on the flow in your facility. I just made this up. This is not any kind of template, but I just wanted to show you how you can do it in Word. If you're using PowerPoint, it's very similar. You go to wherever it says shapes. For Excel, it's the same thing. When you go to shapes, what happens is automatically these drawing tools bar comes out, and you can pull down whatever. These are the shapes over here. So you pull down a box, and you can change it to whatever color you want. Put in arrows, put in big bolded arrows. I just pull down a bunch of shapes to show you what that looks like on your screen. If you're more familiar with Excel, that might be more comfortable. It's nice that it has grid lines so that you keep everything kind of even. And then when you actually print it or display it, you can take off the lines. I notice when I do it by hand, sometimes my stuff is a little off because I'm not very much of an artist. The program that I mentioned, Creately, it's actually a company. I have no, I just found them. I have no interest in them. And I'm not saying that you need to get them. I'm just showing an example of what a flow chart would look like. And when I went to Creately and I looked at the telemedicine workflow, this is what came up. Now, I don't expect you to read that. It's really small. I just want you to see how flow charts look. And you can see they start and end with a red rounded corner. Whenever there's a decision tree, decision making, it's a green diamond shape. And they can say yes or no and move on. And this is pretty much how a workflow goes. And it's easy to follow. This particular one is not for a nursing home. This is for, if you can read it, it's for a clinic setting. You know how now when we see our doctors, we see them by telemedicine instead of in real life. So this is how they do it. This is, they verify the insurance. If it's approved, they go here, they confirm different things along the way, and then they actually have the visit with the physician. So it shows that workflow that everybody can follow. And I'll take you to Creately and let you see how they do things. In fact, I'll do that right now. I can exit this and I'll pull up, where is it? Here. If you're using Google, if you use Google Drive, this is one really great way to do things. I found it on Google. Maybe you use Google Docs or you want to use Google Sheets, but if you go into more, they have something called Google Drawings. And in Google Drawings, it just comes up like this. It's just a plain sheet. I do like that it has little kind of grids or a graph paper so that things are aligned. And then all you really have to do is right here, you can have lines, or here you can have shapes. And when you click on shape and you choose shapes, you get all these different shapes to choose from. Very similar to Word and Excel. This last section is called workflow. So the very first box here is called flow chart. It's called flow chart. This one is the process. If you notice, this little one with the rounded corners is called flow chart terminator. So that's the beginning and end. The parallelogram is flow chart data. The diamond, flow chart decision. So all we have to do is click on this, and I click on this over here, and now I've got a shape. And so it's really great that I can change this shape to be whatever I want. I can make it a different color. I can make it a different size. I can move it around. I can make it this way, you know, do all kinds of different things. And of course, I'm going to end up crooked because that's how I am. And then you can add on the different shapes and add the lines as well that will connect them. So it's pretty easy to do. And then this can be imported because it is Google. It can be imported into any of your docs or your sheets, or it can be imported even into Word or Excel or whatever other programs that people are using. What's nice about Google is because it's live, you can have other team members that can contribute to it in their own time. So when they take a look at the document, they can say, oh, no, it's not like that. We do this first, and then don't forget that step. And they can contribute to this, and it can become a team effort without having to have endless meetings about it. And that's really helpful. For Creately, this is on the web. You can go onto Chrome as well. For Creately, they have all kinds of different things that they do. Let me get to this one. So they can help you create a flow chart like this, and to communicate it to different people, and different team members can contribute. This is a video that you can watch. It's also on YouTube, and they show you a little video about flow charts and what that means. I know you can't see this, but under this, it says, what do you want to do? And all you click on is flow charts. You can also click on, I want to do a site map, or I want to do an organizational chart, because they have different options that you can choose from. If you chose organizational chart, then it takes you to a window where you can pick the different, sections. It'll automatically map it out for you. You can even put people's pictures in there if you wanted to. But the flow chart is what I was interested in. They have all the shapes. They're already in the standard colors that most people like. You can change the color if you want, but they started a flow chart. It goes this way, decisions, and ends. So they already have it, in that kind of format. So I thought this was really nice. And why I'm bringing it up, they give you an overview of what they do, but what I like is that they have a free plan. So if you wanted to just do one flow chart for free, you certainly can. It is a public plan, meaning that other people could see yours, like I saw the telemedicine one. The public plan allows you to do 5 public diagrams and create one project with up to 3 collaborators. So you get all that for free. So I thought that was kind of cool if you want to play around with that. It's real-time collaboration. So again, people can add to it just like on Google. You can export it into a JPEG or a PDF format so that you can share it with other people. So it really is kind of neat. For $5 a month, you get the personal plan where it's not going to be shared with anyone else. So for $5, I felt that that was, a decent option to tell you about. Again, I'm not selling it, and I know nothing about this company, but I just thought it was kind of cool. So if if you're interested in that, just take a look at it at creately.com. So let's see, now I'm going to go back to my original, and we have some great information for you. Dr. Wen is going to share with us about what she's been doing at Kuakini and the flowcharts that she's designed. And then we're also going to have some sharing with Maria Castillo from Ohana Pacific. So right now, I'll turn this back over to Dr. Wen for sharing her flowchart.
Hey, great. Okay, so just to be upfront, this is all a work in progress. Nothing is finalized, and I just wanted to share it because, I'm learning a lot as I go along, and I think learning should be shared because I'm sure that all of us are trying to figure this all out as well. So, when we first started thinking, wow, nursing homes, we gotta start doing telemedicine so we can protect our residents. We can't have a ton of people, going in and out and, into different facilities. And so we just said, well, what's it like? Well, we can model it after like our own, visits. We maybe except we have to schedule it, and then we kind of show up with the nurse, and the nurse gets on the Zoom, and then we can just do what we usually do, maybe turn the camera a couple different ways, and then we should be all set, right? It wasn't that simple, and it turned out to be quite a deal, very complicated. And so we started, we thought, well, what a great learning opportunity. So we got the fellows involved, and we said, well, let's turn this into a QI project. And so we said, well, okay, so this thing is not working, so what should we do? So we started by saying, oh, let's think about Obviously my needs aren't getting met, the physician needs aren't getting met, the nurses needs aren't getting met, we're all stepping all over toes. And so we actually did a sort of a little survey, a quick survey to sort of see, well, what would be the ideal visit, what it would look like. And so we tried to put all those factors into the process as we went along, as we started to design it. And there were a couple of components, and we realized there's a scheduling part of it, and then there's the actual telemed visit. And under the telemed visit, we realized, we're not getting the data we need. So we started to, the fellows actually worked on this worksheet with the input from the nurses and the physicians. And so that's one of the parts of it. The part I wanted to concentrate on is actually the flow diagram part of it. And so I'm going to show you our initial flow chart, which didn't work, but I'm going to show it to you because I think there's lessons learned that when we did this. So hold on a second. Okay, so I'm going to share this screen. Okay, so you can sort of see. So this was we kind of started, well, the MD wants a visit, and then we would categorize what kind of visit would be. It might be acute visit or a research visit, follow-up visit. Then we would schedule it, and then we'd do this, and then the nurse would come in, and then the MD would come in, then the nurse would come in, and then the MD would come in, then the trainee would come in, and then we kind of went all the way around this. And we were trying to do this flow chart, and it didn't work. And we just kept, we just couldn't seem to get the nurses on at the right time. They didn't know there was a telemed visit. Somehow the communication didn't work, and then somehow the other processes didn't work, and the coordination was just, this flow chart just didn't work. And so we realized it was too complicated. And it was interesting because we, simultaneously, some of you are also on this the HRQ, Nursing Home COVID Action Network, that IHI has this QI consultant. And, one of the things that they shared about this was that if it's too complicated, no one will remember the steps, and it won't be consistent, and it's not going to work. So then I realized, yes, this is too complicated, and we really needed to approach this from a different standpoint. The first thing that we realized was that we were approaching it from a physician standpoint, when this was actually, we were trying to create a nursing workflow. So that was kind of biggest error number one. So yeah, so that was quite wrong. So we realized we had to create a nursing workflow, and we had to create a separate physician workflow. And then the other thing that we learned, so we couldn't, like what we were doing here is, before we were, mixing up, the physician does this, then the nurse does this, then the physician does this, then the nurse does this, then the trainee does that. And that was just too complicated. So instead, we actually went back to the drawing board, so to speak, and we tried to simplify this. So I'm going to show you, this was the, oops, oh no, where did it go? Oh, hold on, I'll find it. Oh no, I got to find it again, sorry. I think I accidentally pressed close. Oh, sorry, I got to go back to my. Oh, hold on. Okay, here it is. Okay, now I'm going to share screen. Share screen. There it is. Okay, so this is the So they basically, their advice was you have to take it at a very, very high level, and it should have no more than 3 to 5 boxes. Because if it's more complicated than that, then nobody's going to remember it. And so this helped us really organize it. So we did, we realized that there were different parts of it. And then under each part, we had to look at the details of who, when, how, what, and where. And then we realized that when we were designing our very, very complicated multi-step process, we didn't answer all of these little questions about who was going to do it, when they were going to do it, how they were going to do it, what they needed, and where it would happen. And so we kind of redid the whole thing, organizing it like get telemedicine schedule for the day, see the patient, complete the worksheet, do a telemed visit, and then what happens after the telemed visit. And so so we did this. Oh, I'm sorry. My screen is not shared. Sorry. Can you see that now? Yes. Yes, it is. It's being shared. Okay. So you can see this is a high level, right? So there's only 4 boxes where we get the telemed visit, the patient worksheet, the sorry, this was the schedule, and then this is the actual visit, and then doing the after telemedicine visit. I'm going to just blow this up slightly so you can sort of see. So under getting the telemed schedule for the day, who would do it? And we said, well, maybe, the unit secretary or the shift supervisor. When would the schedule get obtained each day? Maybe we should print the weekly telemed schedule, which is updated daily, add on any extra consult visits, post the schedule at the start of the day, and then also talk about it during the huddle during shift changes. That way, all the communication and the schedule gets communicated, because before somehow things were getting lost through the cracks and we thought it was just simple. Yeah, we just get the schedule going and it should be all set. But there was a gap with the communication. And then we thought, oh, how is this going to be done? Well, it's going to be posted, and then they're going to be printed, and then we're going to give one to each nurse's station and one to each charge nurse. And it's also posted so they can't, if they kind of forget, they can look for it, and it's going to be posted at the front desk near the cardex, And so hopefully that'll work. And then the nurse has to see the patient and complete the worksheet prior to getting on the telemed visit. So before the telemed visit, this is what has to happen. The nurse uses the worksheet as a guide to prepare for the visit. And the worksheet will be found in the file cabinet with the other blank forms. And this is all going to happen on the unit that the patient is located on. And then during the telemed visit, the nurse assigned to the patient and or the additional helper if needed. We say this because, when we didn't designate who exactly it was, sometimes it was the MedPass nurse who didn't know the patient, and, they just got assigned to do it. So, it's important to answer all those questions. Who, when, how, there's an assigned Zoom link for each scheduled visit, and we try to make it simple. That means we didn't have many, many, many different Zoom links. It was just basically one per provider, and that will always be the one, what do you need? And, where do you go? You go to the patient's room, not in the hallway, not in the other common area, not in the, whatever back room, right? It's in their patient room. And then after the visit, the nurse assigned to the patient who did the visit, confirms, reads back the orders, places the orders, and files the worksheet as their note for the day's telemedicine visit. So it doesn't duplicate work, but actually makes it more efficient. And then the orders and the worksheet are placed into the patient's chart. Now, so I think that but the process of doing the simplified high-level flow diagram helped us realize all the gaps that we had when we answered the who, when, how, what, and where that we didn't have before. And then, so the plan is, so we are actually going to be running this through the nursing staff and the unit secretaries and the shift supervisors. They can review it and see what they think. And then they're going to give it a trial run on one unit, on one shift, on one unit, and sort of see if there our problems. And if there's a problem, we will put them under each of these categories, and then we'll get together and try to problem solve each problem. Some of the questions that came up, we said, well, maybe the questions that come up will turn into an FAQ sheet or something, or try to address it in the flow diagram next iteration as part of the PDSA. So that's sort of how that flow diagram got started. And then the fellows then turned it back into a similar flow diagram that we had before, but this time much better organized into with the details of the who, what, when, where, and how, into before the visit, during the visit, and then post-visit, and into a much clearer thing. So, and then we created a separate one for medical staff. So this is one for the physicians, which we haven't reviewed with our docs yet, but, this is going to happen as well, and then create another flow diagram to go with it. But this is just a work in process, and we are learning a lot, and doing a lot of trial and error, and I'd love to see what other people are doing as well. So anyway, I thought it would be helpful to share that, and I'm just going to open it up for questions if anybody has any particular ones. Does anybody have questions? Is anybody facing challenges with their telemed? Okay, you guys are quiet. So I'm going to see Maria. I think, it's great that you want to share as well. So I'm going to let you have a turn at sharing, then see if people have questions after that.
Hi, can you guys hear me?
Mm-hmm.
All right. I didn't do a flow chart. I was just asked to submit a case.
Okay, that's fine.
But I will just kind of talk it through, basically what I submitted. So in our facilities or communities, we do telemedicine visits for two reasons. One of them is one of our PCPs that sees residents in our communities does their visits remotely. So they no longer come into the facility. They do all their visits telemed lately. And then the other one is if we have somebody in the facility who needs to go see a specialist. I mean, with the COVID, we're still, trying not to do optional, what we consider kind of optional, nice to have, but not necessary visits. So it's really limited to, if they have to go see their cardiologist because of their pacer or that kind of situation. So if they do need to have an appointment and it can be done by telemed, then that's the preferred method right now. So if they do go see, if they need a visit post-op, or the infectious disease doc wants to see, what's going on with the wound or the cellulitis or whatever, then we can do telemedicine. And basically those appointments are scheduled with our unit coordinators or ward clerk type position. And then shortly before that appointment happens, the unit coordinator makes sure the nurse is ready, and then calls the physician's office to make sure they're ready, and then sends the link for the telemedicine meeting. And then it happens. And then after the meeting, the nurse documents on the visit and the outcome of the visit, that kind of thing. So the big challenges are, one, we have to use a very specific platform, because that's what we have a business agreement with Google Chrome. So we use Chrome Teams or Google Teams or whatever it is to do our telemedicine visits. But some of the physicians, the specialists prefer to use Zoom or their own platform, which we shouldn't be using because we don't have a business agreement with them. So that's one of the challenges. The big challenge obviously is the time suck that's involved because, the nurses are, they have a steady stream of work throughout their shift anyway. And then to have that visit with the physician, it can take like an hour, from the time you connect the call and get the residents ready to go, the physicians ready to go, and all the questions get answered and everything gets done. And then the documentation, it's a big chunk of time. So the ward clerks do try to space out the appointments so that no nurse has, more than one during their shift, but that's not always possible. And then sometimes, a specialist will just call in even when it's not scheduled. They'll just kind of do an unscheduled, want to see the resident, and then there has to be this impromptu telemedicine visit. Or even if it is scheduled at the scheduled time, maybe the office isn't ready, or maybe the resident, something's going on, and so there's a delay there too, and that creates complications for both sides. So those are some of the challenges that we have with telemedicine visits in our facilities. But obviously it's nice, to have firsthand knowledge of, what the specialist is thinking and what the plan is, because sometimes that's not always well communicated in the consult form that might come back with a resident that was sent out for an office visit. So it's nice that everybody kind of has a clear understanding of what's going on and what the plan is. So there is an upside to it. But just, I think there can be gains in efficiency if we could figure some things out.
Yeah, it certainly has a whole other layer of complexity. I know some other facilities on Oahu or other islands. I mean, yeah, different providers prefer different platforms. So if you're an HPH patient, an HPH physician, or in one facility, and then there's another one with Queens, and then there's another one from, the geriatric department, and they use HPH, and then it could be like, then there's Kaiser patients, and then everybody has their own preferred thing. So then I know that they really had to create a whole other workflow to accommodate for all those complexities as well. So yeah, it gets more complicated as we try to tease it out. And so that's why we're still, a year later, right, we're still working on this thing. And it's quite complicated. I see other providers here on the Zoom, and wondering what their experience or input is on how telemedicine is going. Nicole, Poliana, what's your experience with telemedicine in your facility?
Oh my, that was unexpected.
Oh, sorry. Yeah.
That's okay. We are not using telehealth inside our building right now. We're using but we haven't done any telehealth inside the building at the moment.
Oh yeah, keep life as simple as possible.
Yeah, well, we're sort of, we're spoiled because we have one attending for the whole facility, and myself. So the exposure risk for regular, SNF visits is minimized by just having it be one person or two people. So, so that's how, we didn't feel like it was entirely necessary to make a whole nother process, I guess. I can see how it would really benefit for the specialty visits. But again, the complexity of having a new process like you're talking about and the amount of time versus the benefit, we'd have to weigh that one out, I think.
Yeah, well, you're fortunate in that respect. Yeah, some of our facilities here on Oahu have multiple providers from multiple places. in one facility, and then when there's an outbreak, that absolutely necessitates a telemed visit.
Yes, yes.
So that's why we figured we need to have, even if we're not, some people are doing in-person visits, as much as possible, we have to be telemed ready.
Right. Well, we have iPads, and we have iPads, and we have stands
Uh-huh.
that we could use in kind of real time. So.
Yeah. So, well, Joy was wondering, would it be helpful to ask for flowcharts from different providers and doctors? I don't know. Every facility is just really quite unique, and it'd be a little bit difficult to use, lift it off each other. But I think there are lessons learned that might be helpful. And I think this would be a great place, a great forum to share if we all don't mind.
Hi, it's Naomi.
Yes.
Marita from St. Francis.
Yes.
So we don't have any televideo platform with St. Francis, but what's been really great is through the Doximity, the Doximity social site for physicians. So it provides a lot of things like a free fax, which is HIPAA compliant, and also a dialer mode. I don't know if some of you guys are aware, dialer, where you can make phone calls to a person, whoever, and it blocks your call, and it goes back to, like for me, it's going to list St. Francis number as originator. And I can also, I guess in May, so the dialer, they started like around April last year, really timely. And then around May, they started the televideo. And so I will call my patients using that application on my phone, so that I can call any phone, any cell phone, whether it's any smartphone, and it blocks my personal cell phone number or my work cell phone number, and identifies St. Francis. So that's great when it works. Sometimes the reception's really poor. So then I have to use the FaceTime, and then sometimes the families and patients call me directly any time of day or night. So I'm trying to avoid that, but otherwise it looks really great. And I've been able to teach people who don't even know how to use these little gadgets, that some of them have been really great in learning them. It may take a little time, but a lot of them are novices, like I was, and that's been great. So I think that's amazing. And for us in our area, we are, lone rangers, so as physicians, and so we make our own schedules, and so we don't have to have any particular flow sheets. So just FYI. But anyway, so people who want to be able to have that platform, it's all through Doximity. You can sign up, and it's free.
Yeah, I think a number of our physicians like that too. I use it for faxing all the time. Yeah. Anybody else have comments or experiences they want to share?
Hi, Dr. Wen. It's Mahe.
Hi. Oh, hi, Mahe.
Hi, everyone. I'm in primary care outpatient, so a little bit different situation than some of you folks, but I do appreciate this talk today on flowcharts. We don't have one in our office for telemed visits, so definitely something that I'll think about implementing. I do, in addition to seeing community dwelling patients, I do have some patients that live in assisted living facilities. And right now I'm doing for all patients like 80% telemedicine. So it's real helpful for those living in the facilities. Those for sure I can do a video telemedicine visit with because of the help of the nursing staff. They have the equipment, they can do vitals. But for my community dwelling patients, I really don't have a whole lot that can have the capability to do video telemed visits. They either don't have a smartphone, laptop, computer, don't have access to internet. So we're relying a lot on audio only telephone visits. And I'm real appreciative for the nursing home training that I got from you folks, because I can imagine other community PCPs out there, the discomfort with managing things over the telephone only. And that was part of our training, just being on the nursing home rotations and taking call and just trying to figure things out by telephone. Definitely in the nursing home, it's a more controlled environment. We have the assistance of the nurses who can do vitals, they can do limited physical exam, they know the medications. So it's still challenging for our outpatients because I don't have all of those clues and history to rely upon, but still a lot of help from the nursing home training to be able to move forward and provide remote care to the patients on my panel.
Yeah,
That's all,
thanks.
thanks.
Yeah, no, thanks. No, definitely different challenges. I mean, one, if you're doing, outpatient, you need to, and the patients don't know how to use telemedicine. You kind of have to give them a little bit of a primer before the visit, and prepare them and things like that, or try to figure that out. So maybe that's part of the workflow, right? Is try to figure out, okay, who makes the initial phone call, who tries to figure out what's possible, and then things like that. But for nursing homes or assisted living, then you have to work out the schedule of the caregiver or the nurse, which they have schedules too. So needing to work that in. Great. Any more thoughts or comments? Anyway, I hope this little primer on flowcharts is helpful and you can use it for your quality improvement. Try to make things a little bit smoother where you're working. And let us know how it goes if it works out. Okay. So I guess it's pretty much the top of the hour. So just want to close in saying, remember to, I think if Michaela can put a link, right? Oh, there's a link right there. So to fill out for CMEs. And if anybody, if your friends or your colleagues have missed this session, these sessions are recorded and you can let them know and they can listen on their own as well. But unfortunately, if you listen to the recording, you can't get the CME for that. So tune in. Next month, we'll be talking about PDSA, Plan, Do, Study, Act. Okay. Thanks, everybody. Okay, I think that's we're done. Thanks.